Timothy Nolan, Ryan Tracy, Jay Neary, and Ty Garber. So if anyone has any they said they were coming, right, Fabiola, I think, or they didn't say they weren't coming, right?
They didn't say they weren't.
Okay.
Yay.
Okay. Perfect. So that we have Murray and we have Jay and we have a quorum, right?
Yep.
Okay, great. Thanks, everyone. Welcome to our March Medical Marijuana Testing Advisory Council meeting. Sorry, it's taken us a few minutes to get everyone online, but I'm going to go ahead and I'm going to do a quick roll call so we can have a confirmation of the quorum at this point. Okay, so I'm going to start at the top here, and if I call your name out and you're online, if you could unmute yourself and let us know that you're in attendance. I'll start with Maxwell Lung.
Yeah.
Max, thank you. Marie Stein, present in the room, thank you. Timothy Nolan. Call again for Timothy Nolan. We don't see Timothy at this point. Ryan Tracy. Call again for Ryan Tracy. We don't see Ryan. Steve Cottrell.
Yes, I am here.
Thank you, Steve. Matt Lascala.
Present.
Thanks, Matt. Joe Demena.
Here.
Thank you. Jay Neary. I know I see.
Good afternoon.
Yep. Thanks, Jay. We have Elizabeth Brady, who's the new representative for DPS, replacing Vincent Figuarelli, who retired recently. However, she cannot make the meeting today. Zhonghua Xiong, I believe, said he couldn't make the meeting. Victor Hugo Ramos Sanchez.
Here.
Thanks, Victor. Ty Garber. I'll call again on Ty Garber. Okay, we don't see Ty here. Nathaniel Allen in the room. Thank you. And then our last three positions are vacant, which I'll talk about at the end of this meeting. And as requested, we'll share those with you so that you can help us try to recruit some people to fill those positions. And that way we're not going to be so close each time when we come to needing a quorum. But we do have a quorum. We have 9 people present. Exactly a quorum, so that allows us to go ahead and move forward with our meeting. So again, welcome everyone. Thank you for taking the time to attend, and thank you to those in the room who could make it here in person today. And thanks to all of you online for joining and taking that time today. Our first item here that we have, as I mentioned on the roll call, we have the retirement of Vince Figuarelli, who was the DPS council representative. That position has been filled by an appointment of that position to Elizabeth Brady, who again can't join us today, but hopefully will be at our future meetings. And so, again, just to give everyone a reminder, as we haven't met in a while, the review of the council's charge, which is 36-2821C, which is the Medical Marijuana Testing Advisory Council shall annually review the marijuana testing program and submit a report by the second Monday in January. And this report should include recommending analytes to be removed from the required statutory testing panel. It should also include de-identified information about testing related deficiencies cited against licensed marijuana facilities. And finally, it should also include any other recommendations on improving the testing program. So with that, we're going to move forward into our first discussion presentation today, and it is going to be analytes and or solvents present when THC is derived from hemp. And I believe Joe Demena is going to introduce his speaker, Bob Miller, who will be providing this presentation. I'll turn it over to you, Joe.
Thanks, DHS. I really appreciate it. And thank you for giving us an opportunity to present this information to MTAC. I wrote a couple words down. I wanted to get this right. So just want to throw it out there to sort of start the presentation and conversation. First and foremost, I want to make it clear that I believe in the medicinal and life-saving potential of all species of the cannabis plant. And I believe that access to all species of the cannabis plant is beneficial for society for a multitude of reasons. Part of the reason that I'm so passionate about my position as patient representative on the council. However, the federal hemp bill that recently passed has created some downstream confusion regarding hemp-derived cannabinoids on the state level. I'm personally inundated constantly on social media by ads for hemp-derived products, and I know that there's a lot of confusion on the part of patients and customers, and we need to ensure that they're educated and protected. Additionally, hemp-derived cannabinoids circumvent the voter-approved initiative and taxing structure, as well as the legislatively approved testing requirements established for consumer safety. But again, I want to reiterate that hemp can and should be considered for its benefits to society, just in general. So with that in mind, I'm pleased to have Bob Miller, who's PhD and Chief Scientific Officer at ACT Laboratories, Inc. He's here to present some information to us very briefly. Bob is with an out-of-state lab, and they deal with these hemp-derived cannabinoids on a national scale. So we thought it'd be really helpful to get that perspective, kind of zoom out of the Arizona world and take a look at what's happening. And if there's time afterward, I'd love to, potentially have a Q&A or a discussion if anyone would like. And just to make it clear, I have no particular motion in mind. This is simply a discussion and presentation item that I feel needs to be included in the annual report for MTAC. So with that, Bob.
Great. Well, thank you very much. I really appreciate the opportunity, Joe, to get me connected with this group and to the MMTAC to just share some of our perspectives. Maybe a couple things about myself. 35 years in the pharmaceutical industry, over 35 years. I'm a pharmacist by trade and have a PhD in analytical chemistry. And for of those 35 years, I've been in major pharma companies as heads of quality at Gilead, Johnson & Johnson, and Pfizer, and then joined ACT Laboratories 5 years ago, and my current position is Chief Scientific Officer. So my interest in this area was really driven by a number of things. One is the science, and it's an ever-emerging scientific space. And I think the other one really related to safety. Being a pharmacist and being brought up in this whole space of pharmaceuticals, just making sure that I'll call it our people, particularly our children, are safe, and really have done some work that I'd like to share with you, looking at this and then some going forward recommendations. And next slide. So one of the things I want to be really, really clear about is hemp. At the end of the day, we understand the Farm Bill, what that all does. Hemp and its ability, CBD is essentially what is naturally derived by hemp. What is not people really don't fully understand is when you go from CBD to things like Delta-8, that is no longer naturally occurring. That is a chemically derived material that has been synthetically created. So I want to really, first of all, just kind of share that point. That's why I'm calling this hemp-derived intoxicants, because it's really not naturally occurring from its process. There's been a lot of work done to look at this, and much like we're trying to still understand the cannabis plant, this whole space is no different, right? It's an ever-emerging area. And what caught some of the attention is really about the fact that some of these materials like Delta-8, like THCO, which is just another chemically derived component of THC, some of these are as toxic, if not more toxic, than Delta-9 that we're all very much familiar with. In looking at the data, there's always this question about, well, is it really having an impact? And I just quoted some things here. Admittedly, this data is a little bit older. I don't have new data, but the new data tells me that this trend is continuing to increase. But FDA, during a period of time, a little bit over a year, had 104 adverse events for people that acknowledged that they were taking Delta 8 in particular. And through my years of pharmaceutical experience and being heads of quality of other companies, what we always use as the rule of thumb, and FDA said the same thing, is only about 1 in 10 people actually report when they have an event. So you can kind of take that number saying, well, geez, that number's not so high. But when you take that 10x factor, one could argue one adverse event is too many. But you can see this is an ever increasing area. There's also data available looking at poison control center data. And you can see that data there where that number is substantially higher, which sort of corresponds to what's typically underreporting by FDA. What's probably most concerning from my perspective is the fact of the breakdown. So of those, that information from poison control center, you see there's a large combination, 40% or so below the age of 18. And just as interesting is that people that reported this and they said they were unintentionally exposed, 82% of those came from people that were underage, again, under the age of 18. So again, it points this picture. Yes, it impacts people of all ages, but the people that seem to be most adversely impacted are really people that are below the age of 18. And I have some ideas of why that might be. When you look at these products are available. They're readily available. We do business in 6 individual states, that's ACT laboratories. I see these availabilities of these materials quite readily available. Gas stations, convenience store, head shops, clearly all places that have access and people ready access from teenagers being able to have access to these materials. When I was saying before, when you go from hemp to CBD to Delta 8, what I call you create this reactionary soup. And what I just did here, not into a lot of detail, but just talks about some of those different reaction patterns in that if you want to derive non-synthetic Delta 8, you really take CBD and react it with solvents and with acids. HHC, which is another product, uses catalysts. And why this becomes really, really important, catalysts are heavy metals, and heavy metals are tend to be toxic. Also having solvents, which we all know can be toxic if they're present in high enough levels, as well as acids. There was data most recently shown that said when you're taking that synthetic chemical modification from CBD to Delta 8 and beyond, you could create over 30 different cannabinoids. And what I can tell you from a testing laboratory perspective, we're one of the larger number of laboratories that test a larger number of cannabinoids. We test for 16. So there are definitely cannabinoids that if this product were routinely tested, we don't even have capability today to be able to test for them. So you have this combination of products that are somewhat, these are inherently psychoactive. The product is not being tested, and even if it were being tested, we don't have the technology today to be able to readily test them. The good news is the technology on the testing side is rapidly changing. To just give you an idea, we were at ACT Laboratories up until a year or so ago, we had 8 different cannabinoids we were looking for, which tended to be the requirements. We now can see upwards of 22 different cannabinoids. So the great news is the technology testing way is definitely catching up, but there's still a lot of understanding and knowledge we still need to be able to achieve to really truly understand what is in that bottle. Next slide, please. So what we did is we had a request actually from the Department of Health of Pennsylvania because of what was happening in their individual state to say, go ahead and test some products. So what we did is quite randomly went into some local locations near our laboratory, which is in Western Pennsylvania, near the Pittsburgh area. And we just randomly selected 21 different products. What we did do is we made a good attention from the colorful labeling, for example, of the product. So we hand selected, but somewhat randomly selected the materials. And what we were trying to do is to say, okay, looking at those 21 materials, each of them had a stated level of Delta 8 on them. What did we really find? And of those 21 products, only 4 of those had results that were within 10% of what was stated on the label. And why we used the 10% criteria, that's really the cannabis criteria that we have in Pennsylvania. So we were applying that criteria of the plus or minus 10% to be used as a filter of blood. Of those 21, 1 sample had no Delta 8, but most surprisingly so, 9 samples had Delta 9. 5 of those being above the 0.3%, and most shockingly, 1 sample had over 400 milligrams of Delta 9 in the product when it was labeled as that containing Delta 8. 4 samples had appreciable levels of heavy metals, which really is indicative of that catalyst component when you're trying to convert it. And then 1 product had levels of lead, which can, is quite toxic, above the state-defined limits in Pennsylvania. Next slide. I should also mention that ACT Laboratories has a lot of interest from a number of states to continue with this sampling process. We actually have been asked to go back and do it again in Pennsylvania. We've been asked to do it now in Illinois. That'll be soon initiated. And there's now interest in Ohio doing the same. So of the states that we're in, there's absolutely interest in regulations. As you may already know, that there was actually, I testified down in Florida, which is one of the, I should also mention, let me digress 1 second. The 6 states that we're operating in are New York, Pennsylvania, Ohio, Michigan, Illinois, and in Florida. And most recently, Florida just passed regulations to significantly curtail the ability to be able to sell Delta 8 products. So as I was mentioning, there was a lot of activity looking at all these things with a real interest of trying to limit the either exposure to minors or even potentially prohibit its ability to be able to be available. In those same states that have agreed that they will continue to allow for the marketing of Delta 8, what they're absolutely looking at is considering legislation, of which they've asked for technical guidance on, to consider legislation is to define if it can be marketed in the state, what is the defined quality specifications for the product. Not surprisingly, but it's also been interesting. I've also testified at the federal level, and they're looking at similar things, but we're really asking to present what's the status of testing of Delta 8 products. Next slide. So from my perspective, what's needed? Consumer education. I tell people all the time, a patient, a consumer, if you think about our pharmaceutical businesses, our OTC, over-the-counter products, people have confidence that what's on the label is in the bottle. I can unequivocally say for the sample set that we tested, you cannot assume the same for Delta 8. So consumer education becomes clear. Establishment of specifications or standards. My recommendation would be use the same kinds of standards you use for Delta 9. The great news is in states, and Arizona being no different, you have laboratories that do routine cannabis testing. Be able to look at those types of laboratories to use similar types of tests to control for Delta 8 products. We would have to add different cannabinoids or add to the list of cannabinoids, but nonetheless, you've got capabilities, as we do in these other states, to be able to perform such testing and have the technical capabilities and resources to at least start that process. Establish requirements to test batches before being put on the market. Again, to really reinstill customer support, customer confidence rather, and their support, limiting access to the products to minors. Again, where we looked at these products, they could walk right into a convenience store and just purchase it. It was not behind the counter. It was actually, in a number of cases, in front of the counter. And most surprisingly, the packaging. The packaging was very bright, very loud, and was very attractive to bring attention to those packages. So this at a very, very high level is just a summary of the work we've done so far. We continue to do more work. The technology is improving. We're very close to being able to have technology to differentiate synthetic from naturally derived Delta 8 products, but there's still much more work to be done. Thank you all for your time.
Thanks, Bob. And just to kind of bookend that really quick before any sort of big discussion, I think it's noteworthy, and probably most of us are aware that the Attorney General of Arizona recently put out an opinion saying that it is in fact illegal for these hemp-derived cannabinoids to be sold outside of the existing dispensaries. What action she may take is yet to be determined. Obviously, there's a constant legislative struggle over this, but I will just say that to kind of kick off the conversation, as a consumer and as the patient representative, you know, my biggest concern is just being aware of what it is that I'm putting in my body. And I'll be frank with you, the more I learn about, you know, these types of cannabinoids, the more I'm thinking I'll never actually willingly take any of that. So consumer and patient awareness is just so important. So if anyone has any discussion items or questions, feel free to turn it over to the group, and then we'll go from there.
Yeah. Hi, this is Steve. I wanted to ask a question to the nice doctor here. Thank you first off, thank you for doing this. I tried to bring up this topic last year regarding testing. One of the things that we're finding is the biggest problem here in Arizona is we don't know what those chemicals are that people are doing these conversions with, because quite frankly, that's top secret. They're not giving out the golden juice, so we know exactly where to look. Currently, in our residual solvent analysis, we're looking over here to the far right. I have a feeling where we need to be looking so that we're able to detect these additional molecules. We need to be looking as well to the far left. And without understanding, we need to be looking at certain molecular structures, certain chemical structures. We don't know what those are. I think this whole group would love to add these analysis to the residual solvent requirements so that we're able to detect whether these are synthetic cannabinoids. If I know there's a couple companies, edible companies in this marketplace that do use synthetic derived Delta 9 hemp because it's far cheaper to use this than it is to use cannabis extraction. So is there a way for us to understand and potentially add these chemical structures to the testing requirements? Because this really opens up the door for the people that are, it just levels the playing field. This takes those players that say, I'm going to do, extracts for $1 a gram versus everybody else growing their cannabis. And now everybody else is manufacturing their product for $3 a gram, $4 a gram. This levels the playing field for the industry.
Yeah, great question. Unfortunately, I'd be remiss to say what's happening allegedly in Arizona is happening in the states that we're doing business in also, about how to get quote unquote cheap Delta 9 into the operation, unfortunately. Concerning the testing, we're not there yet. There's some really good work being done on multitudes of different groups. There's actually United States Pharmacopoeia, which is not by its name, it implies it's a government agency. It's really not a government agency, but it really is the guiding post for pharmaceuticals. They've done some really nice work on the very different synthetic pathways and what they all could look like. So that number of 30 really comes from some of that data. Where I think it's going to go is we're going to have a screening methodology both on the cannabinoid side, and again, they have some methodology that we're literally evaluating right now, and we'll feel a lot more comfortable about its capabilities. So I'm in contact with them right now. We'll be able to create, I'm going to call this an enhanced profile that wouldn't necessarily be used for, say, routine testing like in cannabis, but could be used to screen for these other materials. So I think there's that place. On the solvent side, the best way we'd be able to do solvents without getting into pretty significant chemistry lesson here is to go to GC Mass Spec. By going to GC Mass Spec, there is software that you could use that would be able to really do a match for other compounds in addition to the ones that are part of your routine compliance bundle. So I think on the solvent side, Those are easier to do and are close to being at your disposal today. On the cannabis side and those other cannabinoids, we're a bit away, but we're rapidly making progress.
Thanks for
Okay,
the information, and thanks a bunch for coming here today, because this is an important topic.
great. Thank you. We got a few questions from folks in the room. Max, I think you were first.
Oh, I just yeah, I just have a quick comment. Thank you very much for the presentation. It's very nice overview. I just want to report that I just come back from the Society of Toxicology meeting a couple of weeks ago, and then I saw that I noticed that you have a couple of citations that is up to 2022. The FDA, their National Center for Toxicological Research in Arkansas, they actually have tests for a library of cannabinoids in their cell culture model. Those have implications to drug interaction as well. So, I would just, if you're interested in those, you can send me an email. I can pull those abstract from the conference so that you can have the most up-to-date, references. I think it's important to not, I mean, this clearly, is in the product. And there are new information about the toxicity as well. And then, I can provide those, contact scientists if you are interested.
I would be very interested in that, because I think the good news is there's a lot of people doing work. It's just trying to sort of encompass it all into some kind of a I won't say database, but being able to. But I would absolutely appreciate the
Right.
connection, and I would follow up to become even more educated. That'd be wonderful.
Yeah, thank you.
Welcome, Maurice Stein
I
next.
just had a comment. We work in both the cannabis and the hemp market. And so we're always looking at other states and what others are doing. And it may be beyond the charter of this committee, but if you have any influence over the rest of the cogs in the state wheel, we need to get in front of hemp soon before it gets in front of us. And this is just a stellar example of that. It's unfortunate we don't seem to have the ability to pursue those illegal players out there that are backdooring cannabis and related products. So there's a big black market for that, which I think from my perspective and from a lot of folks starts to cause me to worry about things like health of our patients, of our consumers. And when you can do things like add acids to CBD to produce these other compounds and then produce something that is definitely not good for you, that deeply concerns us. We would really like to see more emphasis and more movement on what the hemp market needs so it can get on its feet.
Thank you, Murray. Anyone else in the room or online have any other comments or questions for Dr. Miller? If you're online, you can raise your hand if you have a question or a comment. We're not seeing any hands raised, so there are no more questions online or in the room. So thank you very much for your presentation, Dr. Miller. We appreciate you sharing that information with the council today.
All right, thank you.
Thanks, Bob.
All right, bye-bye.
Okay, we're going to move on to our next presentation this afternoon, which is assessing arsenic in cannabis. This presentation is going to be by Victor Ramos Sanchez. Victor, I'll turn it over to you.
Thanks. Thanks for the opportunity to present to the committee. Well, the purpose of this talk is to network with all of you interested in participating with us at Northern Arizona University in research. I think I could benefit from all of your expertise in cannabis. So let me just introduce, I was already introduced. I'm an associate professor in analytical chemistry at Northern Arizona. I think I can introduce my lab if we can go to the next slide. So mostly my research group is interested in implementing and designing materials and processes for renewable energy production, but we are guided by the 12 principles of green chemistry. However, I want to also establish a strong research program on green analytical chemistry. That's another intention because my position here is as an analytical chemist. So can we move to the next one? So for those of you that are not familiar with the topic, so I think maybe not all of us, but for the chemist, now the 12 principles of green chemistry are kind like familiar. They were established in the 90s, and they are trying to improve the let's say our practices as chemists in order to avoid pollution. So kind of a thinking ahead and try to prevent waste, trying to improve on energy efficiency. So there are 12 principles, but most of these principles traditionally have been applied to synthetic chemistry. So green analytical chemistry is a little bit more, let's say, newer trend that is also focused on 12 principles, center in the sample, region, instrument, method, waste, and the operator safety. So pretty much a lot of this is based on the original green chemistry principles to like avoiding waste, use non-toxic and safe renewable sources, solvents, avoid, and that's a crucial part, I guess, avoid or reduce sample preparation to a minimum, and also reduce the volume of your sample to a minimum. Uh, there is also a very important aspect focused on developing in situ methods, automated methods, avoiding derivation of samples. So, and using instruments that they don't require a lot of energy. So pretty much that is green analytical chemistry. Can we move to the next slide? So here is where cannabis is important for us to establish this research area in our lab. Obviously, you are more experts. I'm just here since last year, learning a lot about cannabis. I know that you have legalized cannabis here 4 years ago, and I think we are all familiar about the strong capability of cannabis to absorb heavy metals from the soil. And there are a lot of studies exhibiting like users can or patients can have higher levels of heavy metals in blood and urine. If we move to the next one. And I guess, again, you are a lot more experts here. So you know the levels for these heavy metals, arsenic, cadmium, mercury. What are the levels permitted for the product to be released? And we know that there is a stipulation that heavy metals has to be tested for release of products. There is also like some studies that they offer evidence that cannabis vapors, they show lead levels exceeding current established tolerance limits. And maybe here is where you can give me some advice. To my knowledge, there is no compulsory testing method for heavy metals. Although when I look at the list of authorized testing labs, most of them declare ICP as the preferred method for testing heavy metals. Okay, so can we move to the next one? So here is the point of interest for research. Also, like our region presents significant levels of arsenic and also uranium from well water. This is there is a spatial relationship between these elements, uranium and arsenic. Usually from mining activities is that you can get these elevated levels of uranium, and this uranium is associated with arsenic. And there is a very concerning study that public drinking water is affected nationwide but particularly in underrepresented communities with interesting or well exceeded levels of arsenic in these communities. So can we move to the next? So so at this point, I would like to introduce, if you are not familiar with this, probably X-ray fluorescence is kind of more traditional method, but total reflection X-ray fluorescence is not that common. So basically, we are trying to use for our research for the assessment of arsenic in cannabis that we are proposing. We are trying to use a technique that is called total reflection X-ray fluorescence. So unlike the traditional X-ray fluorescence, where you can have like detection limits not as good as ICP, here in TXRF, you can improve your limits of detections by having a X-ray hidden on your sample with a grazing angle that is almost 0 degrees. And we are putting our sample in a reflective sample disk. So, and the sample disk is almost touching the detector. So like all the fluorescence photons that you get from irradiating your sample with X-rays of high energy, you have all these photons going into the detector, like it's almost touching your sample. Therefore, the collection efficiency of these photons is really high, and therefore you have an improved detection limit. But also, you can neglect at some extension, you can neglect the effect of your matrix in your sample. So that means that unlike ICP, you don't really need to digest your sample if it's not strictly necessary. Okay, so you can use, you can put over your sample disk either solids, either liquids, or you can put your normal digested sample. So this is PXR app basically. So you have an X-ray tube, you have your monochromator and detector that is based on silicon, and that's it. So that's the instrument that we are trying to use. Can we move to the next slide? So this is not it's a very well-established technique. We can see here the sensitivity depending on the elements and depending which fluorescent lines we are using for each element, we can get like really good limits of detection. And there are even some ISO guidelines, international recognized, like to do analysis of water by using TXRF, which is this ISO 28289, that it was published on almost 6 years ago. And we move to the next one. And there are some commercially available equipment like this. And the advantage of some of these equipment is that they are portable, unlike an ICP system. Can we move to the next one? And this is the one that we use, the S2 Picafox. There is another newer version for TXRF from this company. And there is another ISO guideline, which is the ISO 18507, that it was published almost 10 years ago. And this is not just for water, it's like for any biological and environmental samples that you want to analyze using TXRF. So it's a well-established technique in the internationally recognized. So can we move on to the next? So basically, what I wanted to present here, well, the purpose of this presentation is like talk to you, try to network with all of you that might be interested in participating in the future with us at Northern Arizona University. I already made some contacts thanks to the committee that introduced me a lot of people that is interested in providing me at this point with analytical samples, not cannabis samples yet. And well, we are interested in the future. As soon as we deal with all the DEA licensing in the university, we would love to work with plant waxes, soil edibles, extracts, and we basically are trying to validate TXRF as a suitable method to be recognized, or well, it is already recognized, but to be, let's say, to try to make this a popular alternative to ICP as a way to assess heavy metals in cannabis and cannabis products. So that's it. That's basically the purpose of today's talk. Thanks for your attention.
Thank you, Victor. I'll open it up to the council members. Anyone have any questions or comments or go ahead, Mark.
You define green chemistry as involving minimal processing or preparation of your samples.
Yes.
Is that consistent with the use of this kind of device, or is it more particular?
Yeah, that's a good, excellent question, I guess. Like perhaps if we are able to do like analysis, let's say I'm testing right now, like my students, they are doing now experiments with just to get familiar. They are doing testing with dry plants and things like that. So you only need like in the order of micrograms or milligrams to put into the sample disk to get the analysis done. So in terms of how much do you need of your sample for ICP compared with what you need for TXRF? For TXRF, you need a lot less of your sample. And if there is, if we can validate that we don't need to do digestion of our samples, then we can avoid digestion. Therefore, we don't need that much sample. One of the reasons that sometimes you need a lot of sample is because when you digest your samples, you get rid of all the organic, and then the amount that you get at the end of your analytes is really a small amount, and then you need therefore like a larger amount of your sample to get a suitable amount to be detected by your technique. In this case, like one of my students is now working with, because there is also like concerns with arsenic in rice. So we are working with just like a grain of rice. That's enough to do the testing, and that's plenty of sample. So in terms of volume of your sample, yes, we require a lot less volume of sample.
Have you done any studies to compare your results versus that of, say, one of the cannabis labs here in Arizona?
That's the reason of networking today. Like I would love, my students, my research students, would love to like have the opportunity to deal with some samples that they may be already analyzed by ICP and try to do the validation and compare our results and see how proficient is the XRF compared with results that you get from ICP. Because in terms also of like analysis, so you can have a decent result of your sample in like 5 minutes. So yeah, basically you hit your sample by 5 minutes, and then you have the multi-element spectral profile, and then from there you can quantify your analytes in 5 minutes.
Great. Thank you very much for that. This is Murray Stein. I will reach out to you, Victor, subsequent to this meeting. We'd love to chat with you.
Okay.
We're a manufacturer, and we make a wide suite of products, some of which have challenges being tested.
Okay. Sounds
so,
awesome.
We'll touch base with you.
Yeah, it would be great. Thank you.
We see Steve Cottrell online. Would you like to ask your question, please, or comment?
Yeah, thank you. So these validations that you're working on validations, obviously currently right now for this particular method.
Yeah.
My question is, so I believe there's 4 or 5 analytes that we have to test for in heavy metal analysis, and it's very important to. So we understand that you can identify arsenic, but what about the other analytes that we're supposed to test for here? Look, the idea of saving a sample size is wonderful. It's faster. ICP-MS is big, heavy. It's expensive to operate. So this is possibly the future. But how long before you see the total validation of this process coming
Okay.
into play?
Okay, thank you for this question. It's a great question. So really, the reason that I mean, we can, I think we can assess like all the heavy metals like cadmium, lead, arsenic. Which other is in the list? On the statutory, I mean, the stipulated heavy metals that we need to test for, like if you want to release a batch of product. So TXRF is okay with cadmium, lead, arsenic, mercury. The thing here is they don't offer the same limits of detection. Like all of them, they don't exhibit the same, because depending on the element that we need to assess the particular detection limit. So at this point, honestly, the reason that why we are just talking about arsenic is just because we are trying to deal with arsenic just for a master's process, a master's thesis. But we are interested in doing the validation for all of them, like all the elements that you need to report. How long for that? Based on just research, or I mean, on just a student doing research, is not going to be as in a, I guess, in a testing lab, a regular testing lab. So for us, it's going to be at least a couple of years to get enough students to deal, like at this point with arsenic. Probably I will need another student to deal with cadmium, and so on and so on.
Okay. Great. Thank you, Victor. Any more questions online or in the room for Victor?
I see Brian.
He's not on our call. He can't.
I don't think so. Because he said, I don't know, because we don't take public questions.
Oh, no, it's not the agenda.
Yeah, no, don't have a. So, while this is a public meeting, we don't normally take questions from the public as we don't have it on our agenda.
Okay. Understood.
Anyone else from the council online or in the room that would like to make a comment before we move on?
Oh, I just want to say this is really innovative work. So, yeah, appreciate the presentation.
Right.
Yeah,
Thanks, Max.
really innovative. Yeah.
Okay, well, thank you very much, Victor. Appreciate that information, and hopefully you'll find folks to partner with.
Yeah, thank you for your time. I appreciate all, and I will benefit from all your experience for sure. Thank you.
Okay. Our next item is testing, remediation, and conversion. And this is Matt Lascala. I'll turn it over to you, Matt.
Yeah, thank you. Good afternoon, everybody. No, honestly, when we were talking about topics for discussion, and I was, solicited by Fabiola, I was just trying to further the point that Steve was making last year about continuing this discussion, and I think the presentation by Dr. Miller basically did that very well, much more technically than I would be able to. So, no, I wanted to keep that top of mind, and I think just continuing to search for the analytes, and if there is any markers or precursor chemicals or residuals that we can add to the list, without much change to the testing, I think that would benefit everybody greatly. So, no, that was more my point in that comment. So that's really it.
Okay, great. Thanks, Matt. Anyone in the room or online, any questions or comments for Matt? Okay, thanks, Matt, for bringing that forward. Okay, we're going to move on to our next item. And I believe, Murray, this was your item, testing, documentation, and complexity, but you withdrew it. Is that
I
correct?
withdrew it. First of all, let me call out Fabiola for being just terrific in chasing me. I mean, just great. And I apologize. This topic came up around the time of our last meeting is where the industry was going through this. It may have many words for it, but I'm not going to use them. The transition to of the testing to include supply chain related stuff. And this affects pretty much everybody. And it's challenging when the state does these things, when these changes occur. It's not clear they fully understood what they were asking to do to maintain real-time supply chain information on batches of products sold, because that is non-trivial. And we got lots of calls from people who are freaking out. So we need to consider the IT aspects of these things when we ask people to comply. We also have had, and this pains me a lot, periodically we'll have circumstance where we'll find out from a manufacturer, or not a manufacturer, but a retailer, that they won't carry our product for one reason or another. And we usually have to pursue that. And then we find out that there's been information provided to them as a result of testing, or not of testing, but of inspection. The difficulty, as you can appreciate, is sometimes that information changes over time. There's clear confusion remaining in the market about plus or minus 20%, and whether that's applied to the tested value or the target value. So much so that we had an individual talk to us recently who has lots and lots of experience with this, had received information in one case, but then was contradicted by our information, which was also confirmed by the state. So I don't know that anything's going to be done here, but these are the kind of circumstances that can arise because the conduit for communication isn't always effective. We'll work these issues through the ADA where it's more appropriate, but I wanted to call attention to that, particularly with the confusions that we earlier had. Unrelated to that, I do want to add to Joe's perspective about being very interested in what goes on with the plant itself. And many of us are out there just trying to make a buck, sell cannabis, do their thing. There are some of us who are deeply interested because of the medical side of how we can get the most out of this plant. And that really means diving down and truly understanding it. It's always a concern to us when there can be a medical issue or consideration as a result of something where we're trying to do good. So we applaud any efforts to further testing and making it as accurate and as consistent as possible. Thank you.
Great. Thank you, Murray. Anyone, any comments or questions for Murray? Don't see any online either, so good. Thank you, Murray. Okay, we're going to move on to our last item here, which is proper packaging and complaints. And I believe that is turned over to you, Joe. I'll turn it over.
Thanks, everybody. I appreciate it. And apologies for so many topics. Usually I'm a relatively quiet MTAC member, but we haven't had a chance to get together in so long that I've had a couple things stack up. So one of the things that I wanted to bring to the group's attention, and again, this similar to the previous topic, is not necessarily going to result in a motion, although if it does, I'm certainly not against that. But this is specific to proper packaging, and it's also about unreported complaints specifically to ADHS, but the proper packaging is just kind of the tip of the iceberg. So I believe that the number of deficiencies being reported to the state due to replacement practices on behalf of dispensaries and brands is potentially lower than it should be. In the chat rooms and different sort of social media worlds that I'm looking at, I'm routinely finding customers and patients who purchase products at Arizona licensed dispensaries that have clear deficiencies. This is often including packaging or airtight containers that are not functional and have negatively affected the product, broken, cracked, or dirty concentrate cartridges. Product boxes that have sat on the bottom of freezers and have suffered water damage. And unfortunately, the one that I see the most is human hair being found in the cannabis products. The reason I want to bring this to everyone's attention, obviously there's always going to be an amount of slippage, and the dispensaries and licensed cultivators and product manufacturers are going to do the best practices and their due diligence, and they have inspections from DHS and all of that sort of thing. But what I'm seeing is that instead of sending these potential violations, the customers, I should say, instead of sending these potential violations to the Department of Health, very often the brand reps are reaching out on these message boards or via social media to offer to replace the product. A lot of times that doesn't even pan out, but sometimes it does. And I do appreciate that that go-to attitude on behalf of brands. That's the kind of loyalty and important relationship that a consumer would want between a brand that they respect and rely on. But I think that it's important to note that this practice sidelines numerous potential citations and violations that would otherwise be reported to the Department of Health Services. And by dispensaries and brands routinely avoiding, I should say, routinely reaching out to these and trying to make it right, they are sidestepping potential deficiencies that would in fact benefit the consumer if they were to receive actual citations and violations for these issues. So what I'm trying to say essentially is they keep replacing products and consumers aren't reporting it because they are being replaced, or at least they're promising to replace, and nothing changes in this system. So based on, the whatever discussion or consideration, maybe we table this and talk about it later on. It may be necessary to consider randomized testing improvements, new recommendations to be considered. And I think it also may be important to consider putting on packaging labels, the options of a consumer if the product does not meet the standards established by the state. Again, I'm not asking for a motion or anything, but I do think it's an important topic of discussion. So I'm curious what y'all think.
Okay, thanks, Joe.
I would like to
Turn it
add
over
to that.
Steve, go ahead.
Many of these products that are being substituted for defective product are also not in the system. So manufacturers are taking this product, and we see this a lot with samples. They're coming in and they're not even hitting the system. So manufacturers are also skirting the rules with the department.
That's pretty troubling. So they're essentially, if I understand you right, Steve, sometimes these products that are already deficient and not functional are being replaced with something that may or may not have been tested, or at least the consumer can't verify that it's gone through the proper testing channels. Is that correct?
That's absolutely correct.
Okay, thanks, Steve, for your comment. Murray?
I just want to add to this that, as a manufacturer, kind of, the middle guy in the middle. And at one time we held a certificate, ran a dispensary, worked with a cultivation, the whole nine yards. Today we just make products. So that's where we fit into the ecosystem. So we have a unique experience in terms of, we don't have the same relationship with the state that a license holder does. The communication path to the state is not the same. We have to work with our license holder or directly with the state or in committees like this to really understand what's going on. And it is absolutely true when there's a issue with a product. And I had an inspector take issue that I used the word apply liberally on a label, even though it provided the full dosage information. They took issue that I said liberally. Now, I'm not even going to address that one and why it's so subjective, but it's problematic. Well, we went out and spent $1,000, reprinted those labels and so forth. I would not have known that product was being told to pull off the shelves by that particular inspector if we hadn't done some footwork that really shouldn't be necessary. The retailers are so busy dealing with compliance and inventory challenges that are related to compliance. My God, those people are overworked. I would not want to be a compliance / inventory manager in an Arizona dispensary operation right now because it's tough. And you've got a zillion manufacturers coming at you with their products. It's just got to be really hard. It would be nice if, when there were issues on a part of the state, if they were reported formally so the manufacturer could hear about it. That's my contribution.
Okay, thanks, Murray. Any other questions or comments online or in the room?
I have a question. Do we have the ability to, on this particular topic, do we have the ability to add fines to manufacturers that they feel they don't need to obey the rules? I look to probably to Megan and Daryl on that one.
So when we have repeat citations for the same offense, we do have the ability to level civil money penalties. There is a limitation as to the amount of civil money penalties we are allowed to levy within the statute.
Okay. Thank you.
I guess just to kind of maybe wrap it up, since it sounds like we're kind of winding down on that topic, I would just say that if the group has any thoughts that you'd like to bring back at the next meeting to maybe discuss that could potentially result in a motion on this, I'm very much open to discussing that. This is a lot of information all at once, and operationally the relationship between license holders, manufacturers, and all the different brands is obviously convoluted at best and not necessarily that simple. So if you do have any thoughts, gang, please feel free to let me know, and we can put it back on the agenda and discuss it again and figure out ways that we can officially suggest to the legislature to get these issues resolved, or at least to not allow certain entities to sideswipe the rules like Steve was mentioning, because that is extremely troubling.
Well, and thank you, Joe, for bringing up the legislature too, because part of the reason why the department does not deal with those third-party manufacturers is because the statutory requirements don't allow us to. We really only have the ability within statute to recognize our licensees and to govern our licensees. And the way that our licenses are vertically done, there really isn't any pathway for us to do that at this time.
Can I ask a question? And I want to challenge that, because as you stated, you do oversight on the license. A third-party manufacturer operates under your purview of the license holder. So why don't you have the ability to, and I'm just asking you this general question, why don't you have the ability to say, hey, Mr. ABC Edible Company, we're fining you for, let's say, expired product, or we're fining you for this, or why don't you have that ability to, when it if that's the case, every edible company should be a third-party manufacturer. That way you have no oversight over anything they do.
But we do have oversight over the licensee. So it's the licensee who gets that statement of deficiencies and would work with their third-party vendor should they choose to use one. If they don't use a third-party vendor, that process is directly under the license. So yeah, everything is issued to the licensee.
Thank you for the clarification.
Okay, Murray?
Can a change be affected by rule changes?
So the way that rules work, rules have to follow the statute. Because of the way the statute is written, there wouldn't be a rule that we would be able to write to make the change that you are suggesting at this time.
I have two other questions unrelated to the prior conversation. I don't know if you've got answers to them, but one of them was the submission of recommendations as part of your annual report. Is there a status update on that? Has it been submitted, and when would, if so, the recommendations, if approved, when would they take effect?
Well, it's a matter of public knowledge that just saying because it's not on the agenda, but it's a matter of public knowledge. So I can't say that, yes, the report was submitted to the legislature per our requirements. The legislature is not required to tell us anything that they might be doing. And I'll be honest, I haven't been following the bills that have been going through very closely in order to be able to answer your question directly, but not to my knowledge.
The second question is sort of related to that, and that is, we know that there's a bunch of bills floating around. It's happy season or something, I don't know. Some of those suggest the creation of a different administrative body. And the question is, would that take the place of the MMTAC, to your knowledge, or not?
on the agenda, we shouldn't talk about it.
You don't know anything about it? Okay.
Yeah, yeah,
Are you
because,
the legal
so,
guy?
I'm the legal
yes.
guy.
he's the
Always
legal
one
guy.
of you in the room.
Always.
Sherman and Howard, our legal representation is here. Craig Morgan is here from Sherman and Howard. And because that's not on the agenda, we won't be able to talk about it at this time, but we can definitely add it to the April agenda and talk about it at that time.
Great. Any other final comments for Joe?
Not for Joe, but I want to say of all of the years that we've been doing this MTAC meeting, this has been the most scientifically advanced and, I think productive meeting that we've had in a long time. So I'd like to thank everybody for making quorum and also bringing their A game today, because it's been wonderful.
Brad? Thank you, Steve. Okay. Well, thank you, everyone, again. We've got to our final wrap up here. We had a lot of good topics, as you all heard today. And again, if there are items you want added to the next agenda or people you'd like to hear from that are relevant to our council, please let us know. We'd be happy to get them on the agenda. But as part of our meeting wrap up, we will be sending out information, a schedule, and a form for meetings, so we can get some dates from all of you folks to attend the April and May MTAC meetings. And if you'd like to suggest one of those topics, just please let us know how you see it ties into the charge of the council, so that we can make sure we're talking about things that are pertinent to the group.
Otherwise, as Marie mentioned, Fabiola will be chasing you down.
Okay, and so finally, as we discussed right at the beginning of the meeting, we still have 3 open positions on the council. And so we will send those out to you, but I'll just go through them quickly as we've got time left in our meeting. One of our open positions is a licensed healthcare provider who specializes in treating substance use disorders and who has at least 5 years of experience. Our second member that we're missing is a representative of a nonprofit medical focused, primarily focused on producing medical marijuana edibles, and who has at least 3 years of medical marijuana production experience. And finally, the last member that we need to fill is a lab scientist who holds a doctorate or a Bachelor of Science degree and who has at least 3 years of experience in a cannabis testing lab. So again, we'll send those out to all of you, and if you could let folks know out there, or if you have any folks that are interested, please send them forward to us, and we'd be happy to see if they're eligible to be part of one of those positions on the committee. And again, the more members that we have filled, and the chance we have of being able to meet quorum. We were pretty close today, just getting 9 members. So if we could get a few more people, that gives us that flexibility, especially as we come into certain times of the year, like the summer when people go on vacation and may not be able to make meetings. At least we can at least have that group of people to form the quorum from and continue to do all the great work that you folks do. So again, really appreciate everyone joining today. Those of you as well that were able to make it and meet us face to face here in the room. That's always great to see you folks here in the room. Obviously, online is going to continue to be an option with this council. And again, really appreciate your time and all the great work you do for the MTAC Council. So thanks again. Watch out for that information coming out from Fabiola. You should be getting that soon. We'll get the next meeting on your calendar. Again, appreciate your help. Thanks for being part of the meeting today. Have a great rest of your day. Thank you all. Goodbye.
Thank you.
Thanks,
Have a good
everyone.
one.
Thank you. Thanks, guys. Bye.
Thanks to Kim and all the staff for setting it up.
Thanks, Fabiola.
That's a lot of work.